Yeah. You know what I
So
wonder? I always wondered. So I hear this statement that the hospital has the this or the qualified health center, it closes at 4 and no weekends. Do their patients not get sick on the weekends and evenings? Where do they go?
to the ER, and the hospital owns it.
But I thought that the idea was to reduce the spend.
Not as long as the hospital owns it. I don't care if I'm the hospital. I make more money when you come to the ER. Do well child exams on the qualified health center all day long, so I can meet the highest metrics for any quality incentives. Grow the panel so I can get the per month from the state of New York on the Medicaid, and then send them all to my ER, because then I get to charge them even higher, $1,200 for the viral panel.
Wow.
Love it.
It's a great
So
model.
it's
It's a
a
great
great
model for
model
spend.
for a spend. I'm going to get political
Uh,
again. That's what the Obama administration wanted. Full control of the big health systems. His dream was a bunch of Cleveland clinics, Mayo clinics that are totally, and Kaisers throughout the country. They totally control every aspect from the moment you are pregnant to the moment you die. And they just rake in the dollars because there's these huge machines, not any different than Verizon or
mhm.
Comcast or whatever your local cable provider is. They have a monopoly. They charge what they want. They give you the service they want. And if you don't want it, you don't have cable in your house and you don't have a cell phone. Bye.
But Herb, a lot of physicians who do work for a hospital group, they're not necessarily happier they are.
They're
I've interviewed,
miserable.
I've interviewed quite a few of them, and they're having staffing shortages. They're understaffed with medical assistants. Their voice is not heard because the administration doesn't really care about what a pediatrician in a hospital clinic thinks. I've spoken to pediatricians that sold their practice for hospital groups, and
They hate it.
they hate it. Absolutely.
They
Yeah.
hate it. We, to your point, in your practice, if one of your physicians stayed for half an hour to see an ear infection, you lost money, right? After closing, you lost money because seeing one patient doesn't cover the overhead of that doctor and that front desk person and that medical assistant. But you would probably say, "Thank you so much for doing that. That's what we like. You're doing a great job." If a physician is employed by Stanford and she meets somebody in the parking lot, and then at 5:15 p.m., she's going to get reprimanded, and human resources is going to come in and tell her that once the office is closed, she's not supposed to see patients. She's going to get in trouble for doing the right thing, for taking care of the patient, because it doesn't meet the need of the
System.
front desk people, the medical assistant, the administrator of the clinic, the boss of the administrator of the clinic. And so that's why they're miserable, even when they do the right thing and don't ask for to be compensated for waiting for the patient. They get slapped.
Yes.
That's no way to live. That's no way to be a doctor.
Correct.